Breast cancer is a very common cancer today. World over, the incidence has increased by leaps and bounds. And in India, the breast cancer is also increasing. As of today, 1 in 22 women has a lifetime risk of developing breast cancer in India. It is more an urban disease. It is more common in the metropolitan cities like Pune, Mumbai, and Calcutta, Madras, etc. This slide also shows that the breast cancer in various cities in India, if you see the rural areas and the less affluent areas like Aurangabad and Barsi, the breast cancer is at a very low incidence, whereas if you go to the metropolitan cities, this graph shows a much increased incidence of breast cancer in those cities. It is less common in the rural areas where women are more affected by other types of cancers like cervical cancer than breast cancer. It is estimated that over the next decade or two, breast cancer will increase by at least 3 to 4 folds in our country. The global scenario is such that as the affluence of the country increases, the incidence increases as is shown in this graph, and as the affluence of a country comes down, the incidence of breast cancer is lower. But also the irony is that as the affluence goes up, the mortality is lower, whereas as the affluence comes down in the poorer countries, the mortality is much higher. Breast cancer typically occurs at a very young age, and the peak incidence seems to be at around 45 years of age. The breast cancers are at this age more aggressive. They have a very short life cycle, and the mortality of the disease is high due to being diagnosed at a very late stage. The difference between the Western countries and India is that in the West, the breast cancer is diagnosed at a very early stage, and the mortality of breast cancer is just 10 to 15% at 5 years. Whereas in India, the breast cancer is diagnosed extremely late, where 75% of patients are diagnosed in the late stages, and hence the mortality is very high at around 50 to 60%.